Hi, I'm Dr. Jesse Broderson from Alama Chiropractic Clinic. I wanted to take a moment and discuss my evaluation and treatment of neck pain with you folks. Now it just so happens that Jen is dealing with some neck pain today, and I'm going to show you what it entails when somebody comes into my office and how I treat them and ultimately result in neck pain relief for her, okay? So first thing that we're going to do is evaluate her range of motion. So Jen, where are you feeling your neck pain?
Right here.
Both sides, right there.
Yeah.
Okay, so we're going to check the range of motion. Let me know if you're having pain as we do this, okay? So chin down to your chest. Any pulling discomfort there?
A little bit, not too bad.
Okay. Look up to the roof. Any pain there?
Yeah, that's where I can feel it a little more right in here.
Right.
It's like squishing it.
Okay. Looking straight ahead. Turn your head to the right. Okay. Little sore right there.
Yeah, and it feels kind of good, like it needs a good stretch.
Okay. And turn your head to the left.
Not too much.
Not too bad. Okay, looking straight ahead. Down, bend to the side. Okay. And to the other side. Okay. How about that? Not too bad there.
Not too bad.
Okay, so there were a couple range of motions there that were restricted, and I could see the muscles working a little harder than they should have as she was trying to get down there. And then also I'm going to just palpate the spine and find any tender spots. Now I'm checking for muscle tone and joint fixations. So, any tenderness there? Okay. What about down here in the shoulders?
Yeah, all of that, yeah.
And then maybe this guy here.
Yeah.
Okay. Now, any tenderness on this right?
Yes.
Okay. And then let your head relax. Let it go this way. Okay. Okay. So through my palpation, I've found that she definitely has some right-sided muscle tension and also some joint fixations. Now I've determined that she's had some subluxations. I discussed subluxations on a separate video, and I want you to go and watch that video. It really helps explain what a subluxation is and how it causes pain and dysfunction in the body. So Jen, let's have you go ahead and lie face down. So now I'm going to do my treatment on Jen. This is going to involve some muscle work as well as the adjustment, and then we're going to put her on some therapy. I'm also going to show you some stretches and home care techniques that I'm going to go over with her. Okay, so what I'm going to use on Jen is a vibracussor. This is a handheld massager that we use in my office. This is a great tool for relaxing the muscles before the adjustment. It goes like this. I'm primarily going to do it over the larger muscles of the back, the trap muscles that insert up into the base of the skull there. How's that pressure? You okay?
Yeah.
I'm also going to use a tool called the arthrostem. This would be termed an instrument adjusting. I find that using this in combination with my traditional manual adjustments results in a real lasting effect and relief of the neck pain that Jen is dealing with. The instrument delivers a quick, repetitive tapping like that, and the receptors pick that tapping up, and it's a good way to override the pain and dysfunction signals that are coming from the joints in her back and neck. So I find the areas that I want to work on and just give it a quick tap. And again, we're trying to change the neurology here. So now I'm going to perform the manual adjustment on her. I've done some muscle work to loosen up the muscle tension and tightness in her shoulders, and I did some instrument adjusting to change the neuromuscular tension pattern in her body. Now, Jen, what I want you to do is give your shoulders a hug. Good. I'm going to get my hand underneath her back. Go ahead and take a breath in and out. Good, and a little bit of squeeze here. There we go. Real good. And again, right there. Okay, real good. Okay, that feel all right? Okay, good. So we got good releases there in her mid-back, freeing up that joint fixation, trying to take the subluxation pattern out of the vertebra. And now I'm going to adjust her neck. So you just let your head relax. Let's go ahead and undo your ponytail. Okay, so we're going to go to this right side first. Let your head relax here, Jen. Nice and easy. Okay, so we got good releases on her neck as well. Now I'm going to set her up on a therapy and put some ice packs under her back. Go ahead, you can turn that on. Now I have her set on some electrical muscle stimulation. I have the pads over the bulk of the muscles that I want to affect, and this is going to be really good at bringing down the muscle tension and helping with the pain. I'm also going to put her on 2 ice packs, one under the neck and one under the upper back. Go ahead and lay on your back here, Jen. Here's a knee cushion. Okay, and then I turn this up to an intensity that's comfortable for her, and we'll leave her here for 10 minutes. Okay, so we've done our treatment. We've got her adjusted. Jen, go ahead and move your head around, see how that feels.
Good. It's
A little bit better?
Yeah.
Okay, let me check myself. Nice and easy, let your head relax here. Okay, good. Alright, so I'm definitely feeling some improved range of motion. The muscle tone is better. I'm also going to have her go home and do some specific neck and shoulder stretches, and also use an ice pack at home and some topical pain relieving gel that we have here in the office that she's already gotten and has at home for her home care remedies. So specifically I'm going to have her do neck stretches, and in these stretches she's going to hold it for 2 to 3 deep breaths. So what I want you to be doing is doing chin down to chest. Good, and you'll be holding that for a couple deep breaths. Good, and then you're going to come up and look up to the roof. All the stretch you're feeling here, you're breathing into that tightness, big inhales and big exhales. Good, looking straight ahead. We'll do lateral flexion, so bend your head to one side. That's good. And then to the other side. Okay, and then just look to the left. There we go. To the right. Okay, and relax. I'm also going to have you do the sweeping shoulder exercises that I've showed you, okay? And also we give her a specific stretching sheet that she takes home, so in case she doesn't remember all of these stretches. I hope you found this video informative. That's just an example of my neck pain relief protocols. You can get more information at malamachiropractic.com, and you guys have a good day.